Welcome to aminacademy.com, the human anatomy and physiology regarding the cardiovascular system. Let us discuss about disorders of blood pressure. Hypertension. The term hypertension is used to describe a level of blood pressure that, taking all other cardiovascular risk factors into account, would benefit the patients if reduced. Blood pressure readings where systolic and diastolic values fall below 130 to 85 respectively are considered normal. Normal is 130 to 85. Hypertension is classified as essential primary and idiopathic or secondary or other diseases irrespective of the cause. What is essential hypertension? Essential hypertensions, that is hypertensions of unknown cause, is very common in the Western world and accounts for 95% of all cases of hypertension. Treatment aims to prevent complications which can be serious, primarily cardiovascular and renal diseases. That here effects and complication of hypertension. The effects on long-standing and progressively rising blood pressure are serious. First, it about the heart. The rate and force the cardiac contraction are increased to maintain the cardiac output against a sustained rise in arterial pressure. Causes of secondary hypertension: first, brain stroke caused by cerebral hemorrhage is common. The effects depending on the position and size of the ruptured vessels. Kidneys. Hypertension caused kidney damage. Blood vessels. High blood pressure damage blood vessels. The walls of small arteries become hardened, and in larger arteries atheroma is accelerated. Then next one, hypotension. What is hypotension? This usually occurs as a complication of other conditions such as shock or addition disease. Low blood pressure leads to inadequate blood supply to the brain. Depending on the cause, unconsciousness may be brief, fainting, or more prolonged, possibly causing death. Now we will discuss further about disorders of the blood pressure. These are some disorders due to blood pressure. Disorders of blood pressure include both high blood pressure, that is hypertension, and low blood pressure, that hypotension. Hypertension can lead to serious health problems if left unmanaged, while hypotension causes symptoms like dizziness and fainting. What is the blood pressure definition? Hypertension is defined as a blood pressure reading consistently at 130/80 mm of Hg or higher. If it is higher than this limit, it's called a hypertension. Causes. While many causes have no known cause, essentially hypertension, others are linked to underlying conditions like kidney diseases, hormonal disorders, and certain medications. What are its complications? Long-term uncontrolled hypertension can damage blood vessels and increase the risk of the heart attack, stroke, heart failure, kidney diseases, and vision loss. Symptoms. Hypertension often has no noticeable symptoms, making it a silent killer. However, some people may experience headaches, nosebleeds, or shortness of breath. Management. Treatment typically involves lifestyle changes, that is healthy diet, exercise, stress reduction, and if needed, medications like diuretics or ACE inhibitors. Next one, low blood pressure, that is hypotension. What is that? Hypotension is generally defined as a systolic blood pressure below 90 mm of Hg and a diastolic blood pressure below 60 mm of Hg. Causes: hypotension can be caused by dehydration, certain medications, prolonged bed rest, or underlying medical conditions like heart problems or infections. Symptoms: common symptoms include dizziness, light, light, lightheadedness, blurred vision, and fatigue. In severe cases, fainting can occur. What is its management? Treatment focuses on the addressing the underlying causes and in some cases medications like fludrocortisone and midodrine. Secondary hypertension. This type of hypertension is caused by an underlying medical conditions such as kidney diseases or an adrenal tumor. Elevated blood pressure. This is blood pressure reading between 120/80 mm of Hg and 139 to 89 mm of Hg, indicating an increased risk of developing hypertension. Preeclampsia. This is a serious complication of pregnancy characterized by high blood pressure, protein in the urine, and sometimes other symptoms like swelling and headache. So far, we discussed about disorders of blood pressures. If you have done, please subscribe our YouTube channel.